welcome. This is the physical therapy portion of the preoperative presentation that you'll participate in prior to surgery. I'm Chris Lee. I'm from Sport Physical Therapy. We've been a part of Tri-State for 35 years approximately. Proud to be a part of Tri-State and the care that we provide. So today we're going to be going over just some basic information for those of you who are going to be receiving shoulder surgery. Okay. So what I would like to briefly cover today with you is home safety. Going to very briefly touch on the exercises, hospital physical therapy, and then home discharge. So from a home safety standpoint, what I want you to do, and even though you're having shoulder surgery, I still want you to think about safety as you get home from surgery. So I want you to walk through your home from the time that you start to get through the door. I want you to think about, okay, how's my entrance? Are things clear? Okay, is it cluttered? As you start to walk down hallways or in the main living areas, I also want you to think about clutter, things on the floor. What we don't want you to do is we don't want you tripping or falling, especially after having one of these surgeries, because what people tend to do after that is they reach out. We don't want that to happen after this surgery. We want that arm kind of protected. You're going to be in a brace. Again, kind of going through your living room, your main living areas, and then going into your bedroom, same thing. Just making sure that things are easily accessible for you. Some shoulder patients are not able to sleep in bed, so possibly thinking about a recliner. So trying to have some of those things in mind, making sure that things are free of clutter for you, and that it's going to be safe for you. So from an exercise standpoint, we are actually going to focus more on going over the exercises formally in the hospital with you. The reason being is because they're basic movements that we're going to take you through post-surgically, and it really isn't going to do much for you to do those exercises in advance prior to surgery, okay? So, however, having said that, there are two precautions that I want you to keep in mind after surgery. Number one, we want you to keep your elbow at your side, okay? So we want you to not reaching away from the body for about 4 to 6 weeks. The reason is because when the surgeon puts that hardware in there, he has to disrupt some tissue, and we don't want that tissue compromised. We want it to be allowed to go through the basic healing phases for the first few weeks before we start those movements. So we're going to guide you through that again post-surgically, but just something to keep in mind. The second one is we don't want you lifting or carrying more than maybe like a glass of water, up to maybe a pound. You're going to be in a shoulder brace for about 4 to 6 weeks post-operatively, so kind of get used to that thought. It's going to impair what you do. And even if it's your non-dominant side, it's going to dramatically affect what you do, from dressing to bathing to everything else. So keep that in mind. All right, we appreciate your time, and we will see you soon. Thank you.